So in this video, I am going to look into, do I need to treat more of a breathing issue or more of a rotational side bending issue? Now, how I differentiate between this is when I'm up at her shoulders and I am able to take her shoulder blade up into what I call posterior elevation, I can come on her ribs here and spring down and forward to see, is this more of a rotational side bending issue? Okay, because down and forward, up and back are the motions, the accessory or joint kind of motions that the ribs do when we're rotating, when we're relatively side bending. All right, whereas if I'm down at her pelvis and I bring her pelvis down and then I spring up and forward, down and back, I'm looking more of a respiratory or a breathing dysfunction, because when we breathe in, those ribs should go up and forward. When we breathe out, they should relatively be coming down and back. So I'm going to do a quick assessment and treatment based on what I feel like I need to treat. I'm bringing her pelvis down just to lock things out here, and I'm spring testing right in that middle. Those middle ribs on this left side are very restricted. So I'm going to note that. I'm also can push her pelvis up here and then spring test down and back, more for exhalation. Up and forward was for inhalation. So far, inhalation on this left side, more restricted, or the most restricted. I can bring her arm up here and I can spring test, relax the arm, yeah, good. And I can spring test down and forward. Not really feeling a whole lot of restrictions for this relative right rotation here. If I bring her shoulder blade down and forward, and I spring test up and back, I do have a restriction again in that kind of that same area as what I felt whenever I did it from the lower. Okay, so what I'm going to say here is there's actually more of a limitation when I spring test her up and forward from down at the pelvis relative in this position. That tells me that the issue may be more of a breath issue in inhalation on this left side. All right, so if I treat this, bringing the pelvis down and back, I come up onto my restriction, right there, okay? And I can have Keely breathe in and out. And I block it as she breathes out. Breathe in, I'm following it up and forward. And as she breathes out, I'm blocking it from coming down and back. And in, up and forward, and block it as she breathes out. Okay? So again, what I'm looking at there is it more of a breathing issue? Is it more of a rotational side bending issue? Figuring out where the biggest restriction is so that I can save time with what I decide to treat in the clinic. Treat the most restricted, then I could actually come back here and retest, okay, did that help that restriction up and back? Also, it did help it a little bit, but then I could also treat this next if it still had some things that need to be cleaned up. All right, so that's treating the lateral rib cage.